Greetings everyone, I'm Dr. Mandeli. I'm a dermatology resident at our regional referral hospital. And today we're introducing to you our new consultant on board certified Dr. Tripathi Moize Sidani Kasereka. He's going to tell us quite a number of things people out there always want to know about dermatologists. And to start, without further ado, tell us about yourself.
Okay, hello everyone. My name is Dr. Tripathi Moize Sidani, a board certified dermatologist. I'm here with my colleague, Dr. Mandeli Peter, and we are here for you to answer some questions about dermatology.
So to our viewers out there, all of us want to know, who is a dermatologist?
Oh yeah, interesting question. It has been confused a lot of people. Who is a dermatologist? They always think dermatologist, is it someone who sells moisturizers in a shop? Someone who sells soaps? So they always ask a lot of questions, and many questions have been asked about dermatologists. But for today, you have to know that a dermatologist is a specialized doctor in skin conditions, hair conditions, mucous membrane conditions. He can treat also the nails disorders.
Also, some patients that we see in the clinic when they have some issues with mouth, maybe does a dermatologist also go there? Which other areas does a dermatologist cover?
So, like other areas that a dermatologist can cover. Yeah, the way you have said, in the mouth, we have multiple diseases which can happen there. We can also have mucous membrane diseases.
So explain more, what are mucous membranes?
Oh, mucous membranes involve the mouth and also the genitalia.
Thank you.
Yes.
So you've told us who you are, you're a dermatologist, but people out there, even some aspiring medical students, would want to know, how does one become a dermatologist here in Uganda or in the DRC?
In DRC, to become a dermatologist, you have to do primary school, secondary school, especially maybe biomedical, biology and physics. In DRC, it's very different from Uganda. Anyone can become a doctor in DRC. Yeah, even if you did electricity, you can still become a dermatologist.
Okay.
Yeah, so from secondary school, now you choose medicine. General medicine in DRC, we spent almost 8 years doing undergrad. So now after being a general doctor, in our program for dermatology in DRC, you have to spend 5 years to become a certified dermatologist.
Okay. Do you want to share your experience on how someone can become one in Uganda?
Yeah, in Uganda it is quite different from ours. As for them, they do primary school, I think it is 7 years, secondary school 6 years, undergrad program for medicine is 5 years.
It's
5 years.
It's 1 year for internship.
Oh, 1 year of internship. Okay, and then 3 years to become a dermatologist for master's program.
Okay, so what does a dermatologist expect to do? Why would one choose dermatology and not surgery and not obstetrics and not any other specialty in medicine?
Oh, wow. Yeah, I choose those things because, first of all, dermatologists are peaceful people and they are lovely. They always smile. Oh, they are always good-hearted people. So I was just saying, doing dermatology could be the best thing I could choose. Even if they would ask me 100 times, I could just choose dermatology. Yeah, and another thing, dermatologists are very few in Uganda as well in DRC. I think in Uganda, they can have less than 20 dermatologists certified.
Sure.
Yeah, for DRC, they have less than 30 certified dermatologists. So when I was doing undergrad, I can remember patient that I was treating who could have skin conditions. Oh, those patients, I'm wondering now how they are doing, even because I didn't know the diagnosis. And so we have a lot of diseases which are neglected, like scabies, like psoriasis vesicaler. We can have dandruff. Those are diseases that patients will have They will not harm the patient, but the patient will feel, will think they are normal, yet no. We have others like tinea pedis, and we have also acne, in which many patients always think it is normal to have acne, and they always leave it the way it is.
Thank you so much. Since you're hitting that area of dermatological diseases, to add on what my colleague has said, most dermatological conditions are debilitating and they can cause catastrophic pain to the patient. And as we know, many conditions that affect the skin change how the patient feels about themselves, and actually they can lead to stigmatization, low self-esteem, and they can also have a lot of other psychological disturbances. And that's why a dermatologist comes in to cover this gap. And the major goal of a dermatologist, as Moise has hinted before, is to improve the patient's quality of life. And that's what we're here to do.
Yes, improving the quality of life of patients is very important, because apart from those self-esteem, quality of life which is lower, other patients can kill themselves because of skin conditions. So it is very important to do dermatology, and we have to understand that dermatology is among the specialization to choose, because it will make the patient feel confident.
Thank you so much. So tell us, how can patients access dermatological care? How can a patient get to see a qualified board certified dermatologist like Moise here in Uganda or in the DRC?
To see Dr. Osteopathic, the dermatologist, first of all, you can see me in Butembo town, DRC. You can still see me in Goma, Kisangani, in Kinshasa, and other towns like Kisangani and Beni. So for others who are very far, in case you don't have, the way you have said, dermatologists are very few. Sometimes we can try to help few patients online.
Alright, so does that mean that there is an option for teledermatology where you need to serve those patients that can actually not afford to come to the hospital to see you?
Yes, please. It is there, and it is a domain that we have to develop when we are treating patients, as everyone will not have access to dermatologists.
So have you put in consideration mobile apps?
Yes, we are just planning to do a website which we'll be using for consultations and for other things, so that we allow many people to be able to access us, even far from the country.